All of the following are nursing interventions for a patient with high fever except A. Give cold sponge bath, B. Check vital sign, C. Administer medications as per doctor, D. Restrict fluid intake. And the correct answer is D. Restrict fluid intake. Nursing interventions during fever are maintaining body temperature by giving cold applications, satisfying nutritional need including increased fluid, provide adequate rest and sleep, maintain personal hygiene, continuous observing including vital signs and provide all safety precautions. To assess the patient's posterior tibial pulse, a nurse would palpate A. Below the knee, B. Over the medial ankle bone, C. Below the medial ankle bone, D. Below the lateral ankle bone. And the correct answer is C. Below the medial ankle bone. The posterior tibial pulse will be palpating on the inner side of ankle, behind and below the medial ankle bone. Medial ankle bone also known as malleolus. The thumb is not used for taking pulse because A. The thumb is too thick, B. The thumb is too thin, B. There is an artery in the thumb, D. The thumb is put in awkward position. And the correct answer is C. There is an artery in the thumb. Because there is an artery in the thumb that produces a pulse which the nurse could mistake as the client's pulse. So, for taking pulse, fingers tips of hands are used, not a thumb. What is the term used for normal respiratory rhythm and depth in a patient? A. Eupnea, B. Apnea, C. Bradypnea, D. Tachypnea. And the correct answer is A. Eupnea. Therapeutic effect of hot applications is A. Vasoconstriction, B. Increased lymph flow, C. Decreased blood flow, D. Decreased capillary permeability. And the correct answer is B. Increased lymph flow. Hot applications causes vasodilation and increased flow of lymph and blood and increased capillary permeability. A blind diet consists of A. High carbohydrate and high fat, B. Plenty of fibers, C. Non-irritating foods, D. Both A and C. And the correct answer is C. Non-irritating foods. Bland diet means a diet designed to neutralize gastric acidity by providing easily digestible and non-irritable foods. A bland diet may be indicated in treatment of gastric, peptic ulcer and hiatus hernia. Which type of enema is used to provide relief for a client who suffer gaseous distension? A. Soap and water enema, B. Retention enema, C. Medicated enema, D. Carminative enema. And the correct answer is D. Carminative enema. Which of the following is not a parameter of Glasgow coma scale? A. Eye opening, B. Pupillary response, C. Verbal response, D. Motor response. And the correct answer is B. Pupillary response. Glasgow coma scale includes three parameters to assess level of consciousness. They are eye opening, verbal response, and motor response. Glasgow coma scale is used to assess patient's level of consciousness. Which safety measures will you take for a drowsy patient? A. keep the side rails up. B. Keep the light on. C. Keep unnecessary furniture away. D. Keep extra linen at bedside. And the correct answer is A. Keep the side rails up. When caring for a dying patient, A. Keep the patient room dark and quiet. B. Allow patient to express his feelings. C. Discourage if patient talks about death. D. Contact the patient's priest. And the correct answer is B. Allow patient to express his feelings. Gradually decrease of body temperature after death is called A. Mortis. B. Algor mortis. C. Rigor mortis. D. Rigor algor. And the correct answer is B. Algor mortis. Algor mortis means the lowering of body temperature after the death. Catgut suture is made from A. Gut of cat. B. Gut of sheep. C. Gut of horse. D. Gut of camel. And the correct answer is B. Gut of sheep.